Right. So I figured out how to make a PowerPoint for my presentation today, so we'll see how it goes. I'm Dr. Matt. I'm going to talk about, Dr. Aaron, talked about some of the anatomy, some of the phases of tissue healing. Dr. Alexi talked about some of the nutrition and other modalities. I'm going to talk about some of the kind of exercise progression that you can do after an injury. So, as Dr. Aaron was saying, I'm going to focus mainly on, ankle injuries. They're really common, but this is stuff that's kind of, similar for all. Obviously you do different exercises, but the progression is basically the same for all different joints and injuries. So, the inversion ankle sprain is the most common of ankle sprains. That's when you roll your ankle, out. Step off the curb, roll your foot out. That's an inversion lateral ankle sprain. Ankle sprains themselves are responsible for 1/3 of all injuries in sports. So that's a huge percentage, and 3/4 of the ankle sprains are that lateral ankle sprain. So 20% of patients that are physically active will sprain an ankle in their life. I would guess that number is pretty low even. Most people you talk to have probably rolled their ankle at some point, whether it was bad enough where they felt they needed to treat it, maybe not. But, it's 20% is still, a large number of people. The most common age for rolling your ankle are ages 15 to 19. I would assume, developing, sometimes the tissue doesn't get, catching up to our, kind of coordination. Also too, that's a pretty sport heavy age. Don't really see a prevalence male or female under the age of 30. Once 30 and over, it seems like females are a little more likely to roll their ankle, sprain their ankle. So the top 3 sports that you're likely to sprain your ankle in is, I was pretty surprised by this number. Basketball, 41% of ankle sprains in sports are in basketball. Football's is the second highest, and that's only 9%. Soccer, 8%. So if you're in basketball, really this information is important for you. So when we roll our ankle, any kind of joint injury, they grade them differently. So a grade 1 injury is where we're getting some kind of tissue insult. We don't have any major tearing in that tissue, but we're getting some small fiber tears. We're not getting tears across the width of it. But with a grade 1 injury, usually the ankle will be sore. We'll get a little bit swelling. Grade 2 is when we're getting some more tissue tearing. That'll be when it starts to tear across the width of that tissue. Some more, more of that tissue is tearing. We'll get more swollen with this. Usually we'll get some bruising with this. When we get to a grade 3, that's when it's completely ruptured, torn all the way across typically. When we get this, you usually will hear some popping with it. We'll get more of that immediate swelling, bruising. You may feel unstable when you're walking. When my wife was talking earlier, when she rolled her ankle down one time, she has some pretty bad swelling, pretty bad bruising. So, she definitely had a pretty decent grade 2 injury. And like she said, we did a lot to help that recover. When we're looking at ankle injuries, most ankle sprains can be managed conservatively. This is even grade 3 ankle injuries. Depending where you are in life, what you're doing in life, a grade 3 doesn't necessarily need to be surgically repaired. It may be beneficial to get a surgical consultations. Some of the risk benefits of getting a repair would be, you reduce your risk of re-injuring it with surgical repair, but also too, you increase your risk of post-traumatic osteoarthritis, or after you get a surgical repair, because they're going in there cutting. Anytime you damage tissue, whether even if you're repairing it, you're still cutting in there, you're going to increase your risk of getting arthritis. So you kind of depend on what you do. If you're an athlete, or there's just a freak accident, you stepped off a curb, you may not need to recover, repaired. With ankle injuries, like Dr. Aaron was talking about, tissue can take a tremendous amount of time to heal, and so making sure you're healing it properly from the beginning will really help. 1/3 of patients continue to know symptoms 1 year after spraining their ankle. 25% of people report pain, instability, crepitus, which is kind of that noise that you hear when you're moving a joint. Weakness, swelling at 3 years. And so if you're not taking care of this is going to be something that not only hurts in that joint, but then eventually you're walking differently, you're babying it, that'll start hurting the other joints and moving up the chain. Re-injury is common, especially in sports. basketball, again, one of the higher numbers. Basketball is up to 75% increased risk of re-injuring it. If you talk to anybody that played basketball, they act like rolling the ankle is normal in basketball. It's almost like it's expected. It doesn't need to be that way. So the goals with the recovery are to regain full range of motion, strength and proprioception. As Dr. Aaron was talking about, proprioception is kind of your joint knowing where it is in space and time. If we don't have good proprioception, we increase our risk for rolling our ankle because we don't know what our foot placement is when we hit the ground. But also too, after we injure tissue, it takes a while to re-get that proprioception. So that's something we should work on before and after an ankle sprain. Joint restrictions are common with ankle sprains. One thing Dr. Lexi talked about that we did with our ankles, joints, once you sprained them, almost immediately we got the ankle adjusted, we got that joint moving, because a lot of times where that, the muscle will come down in the tendon, it'll attach with the bottom of the foot, and so that, the arch can get, restricted, and when we adjust that, we can get that joint moving properly again. That does goes a long ways in helping that ankle heal. So that's something that we did almost immediately with her. With somebody that's rolled their ankle, you can almost get them from not being able to walk with an adjustment. So grade 1 and 2, should not be fully immobilized. Obviously you want to protect them. That's where you can help tape. Maybe an elastic brace. Sometimes, but you shouldn't be walking around in a boot for multiple weeks after a grade 1, 2 ankle sprain. You're just going to delay that healing. The body needs to move. You need to create a need, and so almost immediately, they talked about managing the swelling, with inflammable blocks, icing, things like that. You need to protect the ankle from additional injury. That's where the taping can come into play. More of an elastic brace. Just so we're keeping it stable, minimizing the risk of re-injuring it. But we do need to get movement in there. We need to maximize the body's capabilities for healing. Dr. Lexi talked about some of that. So with recovery, number 1, we need to restore range of motion in that joint. And so this, we can begin almost immediately with ankle alphabets, kind of any joint you can do it. What you're doing is you're just trying to write the alphabet with that ankle. So you do a capital A, B, C. This is a way to get that joint through all the range of motions, but keep it in with kind of a safe motion. You kind of want to think about green, yellow, red. Green, you're getting motion that's comfortable. It's not painful. Yellow, it's a little uncomfortable. We're not damaging the tissue though. Red is, we want to avoid initially right after an injury where we don't want to be going right through the full range of motion initially, because we want to, that tissue start to heal, but yet we want to get motion in there to help try to realign that tissue. So we want to stay in that green zone initially, just real small, minor alphabet all the time. The body will heal faster if we create a need, and so the more movement we can get in that area, the better, the more resources the body will put to that. Another thing too is with injuries, our body, Dr. Aaron was talking about the nerves coming up, the spine, they cross over going to the brain. Part of the brain doesn't realize what side the stimulus came from. So if we roll our left ankle and we do a lot of these exercises with our right ankle, we'll get a percentage of the resources sent to that other ankle. That'll help with the healing process too. As range of motion improves and pain and swelling decrease, this is when we're going to want to start strengthening the ankle again. When we start to strengthen the ankle again, we want to start strengthening it without moving the joint. These are called isometric exercises. So first, one would be foot flat on the ground. You're just pushing your toes into the ground. This will be called plantar flexion. That's where you can pull your foot up into something. That's dorsiflexion. You can push in on your ankle, push out on your ankle without moving it. We want to keep that joint stable. So if I'm doing isometric exercise in my bicep, when I'm pushing up into my hand like this, that muscle belly is not moving, but yet I'm engaging it. Same thing we want to do with that injury. As the pain swelling continues to decrease, we start to feel better doing those exercises. That's when we can start adding more dynamic movement, start moving that joint as we're strengthening it. This is where that tubing comes into play. We can do a lot of different exercises with that. We want to make sure we're strengthening all ranges of motion in the joint. So up, down, side to side. Another very important factor with recovery is, Dr. Aaron mentioned before, proprioception. This can also be started early in rehab, kind of like when we start the strengthening exercises, how we're not moving the joint. Same thing with proprioception. We can work on it slowly, simply, when you can bear weight with 1 foot. All you can do, simple as just stand in on 1 foot. If you can just do it for 5 seconds, start 5 seconds. You can build up where you go 10, 15, 20. When you get good at it, you can close one eye, then you can close the other eye. You'll slowly start making it more challenging. Once you get really good at that, you can add some instability in your surface. You can do that with folding a towel, standing on the folded towel. That'll be more of an unstable surface. You can stand on a pillow. There's also products you can get, there's those kind of balance pads that you can get a couple different ways, ones of those, and those are ones that you can increase, the instability. Just along, same as with the exercises, as the ankle starts to heal, recover more, and we start getting better at that balance, we can progress with it. One really awesome way to do it is with the wobble board. Those are the circular boards you see with a hole in the middle. That way you can get that ankle through all the ranges of motion with still working on your balance. And so that's great for recovery, and we'll talk about prehab later. So as we're recovering, we want to start exercising again. Kind of the way we build back into exercise is with slowly progressing what kind of exercise we do. One, we can start with straight line activity. This could be walking first, and then building up to a jogging pace, and then obviously running pace eventually. But first we're just going straight line. Then we'll go front to back. That'll give some planting, a little more force on the ankle. Side to side, a little more force yet, and then pivoting and cutting at the final stage. To get return to play, we want to get full pain-free range of motion in that joint. We want to be at least 80-90% of the strength. So if I hurt my left ankle, that ankle should be about 80-90% of the strength of my right ankle before I start returning back to play. So a couple risk factors for spraining your ankle. Dr. Aaron talked about some of this as well. One of the major risk factors is reduced ankle dorsiflexion. Ankle dorsiflexion is if you were to pull your toes towards your shin. So kind of, if this is my foot, pulling that up like that. We should be able to get 45 degrees of dorsiflexion, which doesn't seem like a lot, but you would be amazed at how stiff people's ankles are. If we lose just 11 degrees of dorsiflexion, we're at an increased risk 5 times more likely for an lateral ankle sprain, which is a huge. Previous ankle sprain doubles our risk of re-injury. If you're playing basketball, it's 75% increased risk. Improperly warming up. Dr. Aaron talked about some of the static versus dynamic warm-ups. If our tissues aren't ready for activity, that's when we put ourselves at risk for injury. Fatigue, end of the game. A lot of injuries happen towards the end of the half, end of the game. People are tired. Those muscles aren't going to engage as fast as they could. That's when they start tearing tissue. Overweight, obviously the joint's carrying more weight than it's used to. Poor athletic conditioning. This time of year, a lot of people are doing yard work, injuring themselves that way. But around here, softball's huge in the summer. You see a lot of people in their 30s, 40s, 50s that didn't do a whole lot over the winter. Softball season comes, they're trying to win it for their team. They run, they end up tearing a hamstring, rolling an ankle, things like that. So make sure, if we have a sport coming up, make sure we're properly conditioning for it. So also, too importantly, ways that we can decrease the risk of injury is prehab. Instead of injuring ourselves and rehabbing ourselves, especially if you're somebody that's rolled the ankle a few times, you definitely need to do some prehab. And so prehab is focusing on preventing injuries in the future. And so with prehab, we want to have a large focus on our core, core strength and stability, work on our balance, proprioception. This can be specific to past injuries, or it can just be specific to weaknesses. You've probably all seen people squat where they turn toes in, things like that. That's all stuff that can be corrected, and that'd be good prehab stuff. You're trying to strengthen the body to prevent injuries where you're weak, or just you want to minimize your chance of it. Prehab can be it sounds like it's more work than it really is, and you can get really intensive with prehab, or you can just mix in a couple exercises with your current warm up. I know the girls soccer team in West when they're warming up, they do some exercises, some prehab stuff to prevent ACL injuries. It can be as simple as adding a couple exercises into your what you're already doing for your warm up. it can be a detailed workout that you went to somebody, they saw what you're deficient in, they wrote up an exercise routine for you, plan. It can be a mini workout on your days off, in college on football, on our Sundays, they were kind of, prehab stuff where we do some minor, light stuff on Sunday after games, or, kind of during our season during our training, we did a lot of little exercises to prevent, some of the minor injuries like that. And two, it can be something as simple as on your downtime, you're waiting in line for a drill, or you're waiting in line in the grocery store, you're just standing, on your foot until the person in front of you starts moving. So that's what I have for you today. Dr. Bouch is going to finish it off.